Good afternoon, ladies and gentlemen. Welcome to this new episode of Medcast, your new gateway to the latest medical updates and replying to the rumors we have in the society. Childhood obesity is a significant public health concern worldwide. Over the past few decades, its prevalence has increased dramatically, with millions of children affected. Factors contributing to this trend include poor dietary habits, high consumption of sugary beverages, and a lack of physical activity due to sedentary lifestyle. That's why we have today the clinical dietitian Dr. Hussain AlSarraf to have more discussion about the child obesity and the impact. Welcome, Dr. Hussain.
Thank you.
We are so pleased to have you again.
My
And
pleasure.
today we have a very important subject to our society, especially because we have a higher rates now of children obesity.
Yeah.
Now, what are the primary causes of childhood obesity we have in the society?
Yeah. If we do focus on the factors or say the outlying reasons, we can see actually from different angles. So it's with regard to the person himself. It's this can be applied not just to childhood, but yet to overall individuals. So the beliefs of individual overall does affect with regard to whether the food that he's consuming is healthy or not, and also his convincing, sorry, to the choices he are making. Sometimes he believe that it's not important for me to eat healthy food or at least maintain smaller portion. Then we have the effect of surrounding people. So whether it was the peers in case of the children, whether it was for friends or family members as well. So many times, actually, parents who are overweight or obese will see that the children are actually overweight or obese.
So it's somehow, let's say, genetic.
Genetic and also with regard to behaviors.
Yeah.
So likely that the parent are eating more, say, a high calorie snack, hence the child will be eating the same as well.
And they make him available in the home as well.
Yeah,
Yes.
true. So, and then moving to the broader perspective, we can see also that the infrastructure do affect or increase the likelihood of obesity. So if we do not have enough, say, playgrounds or areas where a child can be more active,
And
that
safe
will be
as well.
unsafe.
Yeah.
Yeah, that's really essential. So that will actually affect as well. And lastly, there are some regulations that might help to have better control with regard to consumption. For example, we see many countries, or at least in Europe, they do have restrictions with regard to the ads that can be played during specifically like after school times.
Yeah.
Uh, I believe in UK they do have restrictions whereby in a specific hours past school specifically, no ads related to children and unhealthy food specifically are allowed.
And the way they are using also to restrict buying high sugar content food, they apply more taxes than the regular ones in the UK
Yeah.
specifically. Now, how has the prevalence of children obesity has changed over the last decade?
Overall, going back to statistics, it is found that it was around, say, 2% in the 90s, but now it's reaching up to, I believe, 8 or 10%.
Which is
And
like fourfold.
yeah, and in Kuwait, unfortunately, the percentage with regard to some studies, it's found that among children, obesity and overweight combined is reaching around 50%.
Now, do you think that the technology has an impact on the children activity
Uh,
and has an impact as well as on the obesity rate?
Yeah, linking back to the introduction, we outlined some factors. So, children are staying more and being less active with
Yes.
regard to screens, whether it was like tablets, video games, TVs, mobile phone, and smartphones. With regard to smartphones, going back to our days, I only got my phone when I was around 18. What about you?
We only had the house's phone as well. So
Yeah,
even if we want to meet our friends, we should go
yeah,
outside and move
true.
around. And
But
it was
now,
very common to play football
yeah.
in the streets as well.
True,
Yeah.
but now you see a child of age, maybe say 6 or 7, he has his own tablet or
Yes.
smartphone, so that do affect, and
Yeah.
they are preferring to see more like say videos on YouTube or some other platforms, and being less active.
Mm.
And then linking back to the choices and the food, of course, when they do see some figures or say animations which they admire specifically,
Yeah.
and mostly they will be eating. Say pizza or burgers, they will tend to crave these kind of foods or even candies. So it does affect, yes.
Okay, now how does that inactivity impact the obesity
Mhm.
of the children?
So overall, it's at least we do have the activity balancing out the caloric intake.
Mm-hmm,
So if a child, for example, is of age of 6 years old,
mm-hmm,
he tend to need around 1500 calorie.
mm-hmm.
So in order to balance out, maybe he's having 1700 calorie. If he does move and have some activity, burning around 300 calories, so he'll be balancing out the extra calories, hence maintaining better weight.
As much as possible, let's say.
Yeah.
Now, is there any like psychological effect if the patient like an obese or something?
Yeah, actually, there are some negative aspects with regard to obesity
Mm-hmm,
and psychological status, or say condition overall. So a child will be tending to have lower self-esteem,
mm-hmm.
less confident. There is a likelihood of having depression. So it does have negative aspects.
Okay, now we know that every case is having alarming signs. That
Mhm.
shows that the child might be in danger or something. So, what are
Yeah.
the alarming signs you would talk about for the parents if they see it on their children? They should like take advice from an expert or something.
So overall, we do take measures with regard to children specifically. We do use something called the growth charts,
Mm-hmm,
in which we take the weight and height of a child
mm-hmm,
and plot it on a piece of paper
mm-hmm,
that is documented by WHO, and also there is one by CDC, in which we can track and see if there is an increased weight or overweight, because it's proportional to height.
mm-hmm,
There is actually a sign that a parent need to be aware is that if we do have a darkened area, especially in the neck
mm-hmm,
and in the underarm, it is a sign of insulin resistance.
mm-hmm.
So if a child do have overweight or obese, having these signs will be alarming in order to avoid having specifically type 2 diabetes.
Hmm. And sometimes as well, it can be a sign of having an imbalance in the hormones
Yeah,
as well as probably a malfunction in the glands or something.
yeah.
Now, if we state that problems and we
Mhm.
got the advice from the experts, how could the
Yeah,
parents encourage their children
yeah,
to have a healthier lifestyle
sure.
and as well as increasing their physical
Yeah,
activities?
it need to be started by the parents themselves.
Mm-hmm,
It's always essential that parents have a good role modeling,
mm-hmm,
because the child will mimic his parents. Many times, not just food or nutrition. All children do follow what their parents does.
mm-hmm,
So whether it was in their action or behavior, so being a role model by simply, if you want to have your child eating more fruits,
mm-hmm.
you need to eat more fruits, especially in front of him or her.
Yeah,
Then controlling the unhealthy snacks or say food even by not having high amounts inside the home,
yeah.
because as we know, Ali, if it's already inside the home,
It
you
will
will
be
eat
easy
it.
accessible. Yeah.
Yeah, and
Yeah.
easy accessible, as you
Mm-hmm.
said. With regard to that, also, if we have unhealthy snacks, it should not be at a place where it's, as you said, accessible. So, not in the living room at the top or the center of a table. Rather, have it more in a drawer or some place that is not easy to remember or easy to reach. Lastly, with regard to activity, they need again to be having good role modeling. So simply don't ask your child to use the treadmill at home or go to the park. Take him and have a walk. It's not necessarily need to be in like a formal direction by telling him, let's go for a walk.
Yeah, at least like for
Simply,
half an hour a day.
yeah, just tell him we are going out to have fun.
Hmm.
He will be more accepting that, and it will be more appealing to him or her.
Yeah.
So these all should be
I do
beneficial.
have two more extra comments on that.
Sure,
Probably that will gonna be like a good advice for the parents.
sure.
First of all, I think they have to write as well as we do in the medicines,
Mhm.
keep it out of the reach of the children if they want
Yeah,
to keep some snacks at home. The
yeah,
other point is
true.
don't give an advice to a child while you
Mhm.
are eating your knafa. So
True.
that's
Yeah,
not gonna be a good role
yeah.
modeling.
Kanafa, or sometimes people will be eating like a chocolate bar
Yes, a chocolate bar.
and tell his child to eat an apple.
Yeah,
He wouldn't
he
really
wouldn't believe
click.
you at all.
Just like smokers,
Yeah.
if like a father is smoking and telling his son not to smoke,
And
he
smoking is harmful for your health,
yeah, he
and he's
won't
doing
really be
so at the same
convinced.
time.
Yeah.
Now, what resources or plans we have in the
Mhm.
community to involve all the community as well in the dietary plan for the children?
Sure. So it's more like developing now among many institutions, whether it was like public or private.
Mm-hmm,
I believe the Smart Diabetes Institute, along with food and drug administration in Kuwait, along with some private sectors, are developing more plans and campaigns, whether it was through schools or even public places. Myself, through the organization I'm working at, we do participate in many events for outreach, as we call it, trying to increase awareness with regard to weight overall and some related like diseases. So there is more to come, inshallah.
Okay, Dr. Ali, one more last question. Would you rather having a snack of a chocolate bar or a protein bar?
For protein bar, it's just so that viewers don't get like a misinformation. Protein bar is more suitable for people who do exercise. So yeah, with exercise, I would prefer chocolate bar. Sorry, protein bar
That's very good
with a
clarification at
chocolate
the end.
flavor.
Okay, that's very great of you. With
Yeah,
a chocolate flavor specifically,
yeah,
rather than other flavors. Dr. Ali, we are so pleased to have you today.
my
Your
pleasure.
speech was very great, and
Thank you.
hopefully we can have you again here in the
Sure,
studio.
inshallah.
Thank you so much. Our dear viewers, we have reached our end of our segments of today's podcast episode. Hopefully we can see you again with another mid-care professional. Until that time, see you later.